Hello, everyone. My name is Shiva Gadareddy,
Hi, I am Akshay Patel.
I'm Nick Christopher.
And I'm Sawyer Combo.
and today our E102 presentation is on AI and robotics in healthcare.
Okay, everyone. So the solution that we will propose to you later, the thing that this whole presentation is about, I'm going to talk about the target audience for that first. So the solution that we'll propose, it's meant to impact all of healthcare, but it's a very general population, right? So more specifically, what we want to do is improve the accuracy at which we diagnose and treat patients. Um, and more specifically, is that we would do this for many third world and less developed nations that don't have access to this like stable sense of healthcare. The solution that we will address is meant to impact these less developed countries because it does not require them to have as many trained doctors that go through decades of schooling. Instead, what we will do is open another sector of industry that'll open jobs for these people in these less developed nations in order to provide a route to provide sustainable healthcare as well as these jobs. So the challenge statement that we have is to reduce the cost of medical procedures and testing in these less developed nations, and to also solve the issue of corruption in healthcare and open a new sector of jobs by making medical information more accessible.
So our solution to all this is to use artificial intelligence, also known as AI, and robotics within this healthcare system to improve the for more correct diagnostics and treatment accuracy, reduce the cost of these procedures and testing in the less developed countries, and also solve the issue of corruption in healthcare in these less developed countries by making this medical information more accessible and widespread to the general public. And how this relates to our grand challenge of advance in health informatics is it directly correlates with the AI aspect of developing an AI system that is good enough to support the robotic system that can be seen in the visuals in the center of the screen, because we would have to work very closely with other engineering people, such as biomedical engineers and electrical engineers, to make sure the system works perfectly. But we will focus on the AI part that will make sure that this system has the proper um, computer brain to then go through with the diagnostics and accuracy that it must have to make sure that these patients are getting the proper care and treatment that is also being done safely and costly effective.
Current solutions that are out there that we could build upon include AI systems that currently are at technology companies such as Babylon that are able to diagnose diseases. We would have to build upon these models because right now Babylon predicts that their AI system can diagnose diseases with 70% accuracy. We would want to get this accuracy up to at least 85% to build upon its medical credibility. The second thing we'd want to do, these current AI systems are based on diseases that are common in the West, in these Western countries, these developed countries. So we would want to add to the database more common diseases faced in third world countries. AI in medicine that are used daily right now are chatbots, robotic surgeries, and virtual nursing assistants. These forms of AI have a database that we could build upon with our system, taking out a lot of the work and money. Some of our design shortcomings is the gap between patient costs when using AI and the cost to the medical institute. Though it may cost the patient less, initially the cost to buy these expensive robotics and AI is very costly to the hospital. So in lesser developed countries where it's known fact that the government spend sustainably less on hospitals, this AI would have to be privately funded. Lastly, in these places where modern technology is new and they don't rely on it, you would need to get the patients comfortable with advanced robotics operating on them.
As Sawyer said earlier, when we're looking at the feasibility of our solution, the biggest hurdle is definitely the cost. Surgical robots like the one in our visual here can cost upwards of millions of dollars. And that is just not something that lesser developed countries have available on hand. So even though in the long term, these can reduce costs and improve patient outcomes, it's still necessary that they have the startup funding upfront, which is a barrier to entry that we might face. Another thing that Sawyer mentioned that is important is that many of the machines in production today are made using databanks with common illnesses in the US. So our next step would be to find databases and databanks for more prevalent illnesses in lesser developed countries that might be eradicated in countries like the US. We would then want to try a small scale study of our solution in a place like Central America where the transportation costs are really low. And after analyzing how it works in that small scale area, we'd be able to scale it up to a larger place and eventually full nations as a whole and build upon our solution. This will pretty much cover our entire presentation. Our acknowledgements are listed below, and thank you for your time.